Hey guys, Dr. Rebecca Warren here from doctorswarren.com, and today I want to talk about something we see a lot of in our office: ear infections. Ear infections have become this common childhood thing that we can run to our doctors for to get checked. But the problem is a majority of ear infections are actually viral. But what does the study say happens 95% of the time when you take your child to the doctor's office? What do you leave with? A prescription for antibiotics. And this is a major issue because a viral infection will not be influenced or affected by antibacterial drugs. And not only that, if there's chronic ear infections, what is the number one recommendations for pediatricians for children? Tubes. And the truth is, Dr. Nathan and I, it didn't really hit us until a few weeks ago. We decided to look into what are those tubes made of and what does the study say about those tubes. Number one, those tubes are made of plastic or Teflon. Yeah, that's right. That chemical that was created to never break down. A chemical that the EPA has been investigating because they cannot believe how toxic it is for our bodies and how we cannot clear it out of our bodies. And this is being put into our children's ears for chronic ear infections. And studies have shown that it does not prevent future ear infections. So you can get those put in, you can start to help the ears drain, but it does not mean your child will not get another ear infection. So what do the studies say? What are we looking at here when it comes to studies on ear infections? We have 3 studies right here I want to share with you guys. This first study is from the Cochrane Database. It's antibiotics for ear infection and infusion in children. What's really interesting is that in this conclusion, I think it's so important because even the American Academy of Pediatrics has started talking about changing up the recommendations for ear infections. Here, the results of our review do not support the routine use of antibiotics for children up to 18 years with ear infections and with effusion. But this is the most important part of this conclusion. Even when clear and relevant benefits of antibiotics have been demonstrated, these must be balanced against the potential adverse effects when making treatment decisions. There are immediate adverse effects of antibiotic use, and those are common, and the emergence of bacterial resistance has been causally linked. It has been linked to the widespread use of antibiotics and for common things such as ear infections. So here's one study that's saying these antibiotics-resistant bacteria that can kill us are being developed because we're overusing antibiotics for things like ear infections. Here's another study. This study is from the New England Journal of Medicine. And so what they looked at is they wanted to see, this is a group of children, and they wanted to see, okay, if we treat one group of children with antibiotics versus placebo, meaning nothing is given to the child, what's the resolution? The resolution by day 7, the children that got antibiotics, they saw a resolution of symptoms of 80%. Those that got placebo, meaning nothing at all, the resolution of those symptoms was at 74%. But this is the heartbreaking part. They talked about diarrhea and diaper area dermatitis were more common among children who received amoxicillin. And that's the first sign that the gut microbiome of those children were disrupted by something as powerful as an antibacterial. And this last study here, Journal of Pediatrics, clinical approach of antimicrobial drugs for acute ear infection, a meta-analysis of 5,400 children. And this is the part right here, the data synthesis, the spontaneous rate of primary control without the use of antibiotics, meaning the resolution of symptoms was 81%. So this isn't doing anything to boost your immune system. This isn't doing anything to fight a virus. This isn't doing anything to fight bacteria. This is literally allowing a child to do nothing and their own amazing bodies will fight this. So what do we do in our office when parents are coming in to see us because they're concerned about ear infections? I will say studies have shown that having bilateral ear infections with discharge saw some positives when using antibacterial medication. And hey, if you have bilateral ear infections with discharge, definitely do something about that. But the study says those other infections, you've got to boost the immune system, not only so that the infection leaves, but that it doesn't come back. The first thing we do is we check our children. We check the nervous system. And if you have a child that's struggling with ear infections, I recommend you see a chiropractor to look at how the brain is communicating with the rest of the body. So not only does it influence the HPA axis, so the brain's ability to communicate with every tissue, cell, and organ, but it also boosts the immune system. So I love doing this with my kids when they're well and when they're sick. The first thing I think is, man, let's support their body so that their body can do exactly what it's created to do, and that's to heal. The next thing we use is garlic oil. Garlic oil is antibacterial, antiviral, antioxidizing, anti. It's amazing that the food that we have, that God has given us, can be so healing. So you can do something like garlic oil. You can make it yourself, organic, cold pressed, olive oil and mashing up some garlic, or you can get it, some mullein garlic oil. You can warm it up and just put it in your child's ear. Just make sure that there isn't any fluid leaking out, because that means there's something going on in there. And if there isn't, you can just put it right in there, and it'll help with bacteria and viruses in that area. And Argentine 23 is antibacterial and antiviral. You can get this in drops, you can get this in spray, but one really good thing about this, the reason why we love it, is because it stops the replication of the bacteria and virus at a cellular level. So you can take it orally and you can put it in your child's ear. So if you guys have any questions at all about ear infections, if you need help finding a doctor near you, or if you guys would like to know more about these supplements, just leave a comment, and thanks for tuning in.